Good evening, ladies and gentlemen. My name is Dr. Richard Arjun Kaul, and welcome to Nine. Today is August the 31st, 2015, and I'm talking to you from New York City in New York. Now, the introduction of the Affordable Health Care Act in 2010 by Barack Obama has been one of the most radical pieces of social legislation to be introduced in the last century. And the main reason for the Affordable Health Care Act, or otherwise known as Obamacare, has been to bring down the rising healthcare costs, which were escalating at an unsustainable rate. Now, in 2015, 18% of the gross domestic product was occupied with the healthcare budget. And those numbers really don't mean too much until you know that the gross domestic product is actually $70 trillion. So 18% of $70 trillion is spent on the healthcare system. Now, this is in comparison to 4 to 5% in the United Kingdom, 7 to 8% in Germany, 8 to 9% in Australia. So it's the highest number in the world, and it's a number that, if it were allowed to continue to rise, would bankrupt America. Now, it hasn't always been 18%, and in fact, in 1970, healthcare only occupied 10% of the gross domestic product. In 1980, it occupied 14% of the gross domestic product. In 1990, it occupied 16% of the gross domestic product. And in the year 2000, it was 17%. So between 2000 and 2015, the percentage change has slowed down, but the actual amount in terms of dollars has increased substantially because of the vastly increased gross domestic product. Now, people want to know why. Why is it that America has a healthcare budget that is twice its nearest competitor? And there are many reasons. The healthcare arena, as I talked about before, is a very complex arena. It's not just medicine. It involves aspects of social change. It involves psychology. It involves economics. It involves politics. There's a lot of different moving parts within the healthcare arena. So finding a solution or a combination of solutions requires that one look at all of these different components. But to try and sort of get a handle on the problem, you have to go back in time to the 1950s and the 1960s and see where things really began to change in society. And it was these changes in society that led on to the epidemics of obesity, the epidemics of diabetes, the epidemics of hypertension that now occupy a substantial part of the healthcare budget. And so America has been synonymous with a number of great technical innovations, and one of them has been the automobile, the car. And Henry Ford worked out a way in the 1950s to mass produce cars. Now, at the time, it must have seemed like a very positive social initiative that was going to allow people to get themselves around in more convenient manners. It was conceived that it would be good for the economy. But what it also did was it took people away from walking to and from work. The amount of time that people spent in their daily activity in walking, in moving from one place to the other, reduced because they would go from their house to their car, get into their car, drive to their workplace, get out of their car, and walk to their office. So the introduction of the automobile and the reliance today of American society on cars is one of the main reasons accounting for the epidemics in obesity. In the late 1950s, the early 1960s, McDonald's, which is the largest fast food chain in the world, came into being. And the first chain opened up in Arizona, and it was to provide fast food to soldiers on military bases. Anyway, the fast food industry is now one of the largest industries in the world and is one of the largest contributors to the epidemics of obesity and diabetes. And they have used the political system in America with the lobbyists and the pay-for-play culture to establish their power base in Washington, D.C. And attempts to curtail the activities of the fast food industries have been very difficult. The other technological advance, which turned out to be also a hindrance and a handicap, has been the television. The television, which really came into mass production in the 1950s in its black and white version, has been an addition to the family life of Americans that again acted to impede physical activity. So families, instead of going out for walks, instead of engaging in physical activity, would sit around the TV in a room, eating fast food, sitting on their comfortable sofas, gaining weight, and setting themselves up and setting their children up for diabetes, hypertension, and obesity. Now, all tied into this was the development of the suburbs. Now, most people up until the late 1940s, early 1950s, lived in cities where people would live in proximity to their workplace, so they'd be able to get up in the morning and they'd be able to walk from where they lived to where they worked. Well, as people began to want more space around where they lived, and they wanted to move out into the greener pastures of rural America, and America had plenty of land for the expansion of the suburbs, they did so. So they built more roads, they built more cars, people had bigger houses, they had bigger lots of land, but they had less time to exercise, and they began to gain more weight. So suburbs and the expansion of that form of living has been a major contributor to the epidemics that now cost the healthcare system 18% of the GDP. In the year 2000, 17% of the GDP was devoted towards healthcare. In 2015, 18%. Now, the Affordable Health Care Act has set out certain goals, and it wants to bring this number down sequentially over the next 10 years to approximately 14%, which is a fairly ambitious goal. And the people who drafted the piece of legislation and the people who are involved in the healthcare industry are looking at ways and solutions to effectuate these changes. And they're also looking at areas of the healthcare arena where there are still contributing factors to maintaining the elevated costs. In America, the medical profession has been under attack for a number of years, and there have been allegations from sectors of the insurance industry that the rising healthcare costs are due to physicians and due to doctors. That's not exactly true. Doctors have been the only profession in America over the last 15 years to have seen a real decrease in their actual earnings, even when it's adjusted for inflation. The only profession. Every other profession, law, accounting, a myriad of businesses, have seen an increase in their actual and real earnings. Now, to go to medical school in America is a very expensive proposition. Students finish high school, they then have to spend 4 years in college, and then 4 years in medical school. So by the time they come out of medical school, they now have loans around about $400,000, and they have to pay those loans off. Now, the Affordable Health Care Act, unfortunately, did not address the issue of the educational fees that are incurred as doctors go through medical school. So I think that has been one of the, and there's a couple of other details in the legislation that I think are going to have to be addressed and modified as things move forward. Because a physician coming out with loans of $400,000 is going to have to make a certain amount of money every month to pay off those loans. Otherwise, you're going to create a disincentive for people to want to go to medical school. The other issue that the Affordable Health Care Act did not address, and which, in my opinion, I think was a political decision, was the issue of the medical malpractice crisis that exists in America. Now, the Affordable Health Care Act was drafted by politicians and lawyers, and lawyers that engage in chasing doctors with for medical malpractice claims make a lot of money in America. Now, that cost has to be borne somewhere in the system, and ultimately it comes back to the insurance companies, because there's a raising of premiums that they inflict on the doctors. So a doctor that gets sued, regardless of whether it's a frivolous or a genuine action, his malpractice coverage will go up the following year. So now the cost that he has to running his business has increased. So that's a further financial pressure on the doctor. Now, certain states in America have introduced what are called malpractice caps, which means that there's a limit on the amount that a plaintiff can obtain in a medical malpractice case. For example, Texas has capped it at $250,000. So is California. There are some states which are referred to as crisis states, which have not introduced caps, and in which excessive verdicts are a common event. For example, New Jersey, New York, parts of the Carolinas. Verdicts come back that are very disproportionate, and there was one recently that came back against an orthopedic surgeon at Columbia who operated on a young child who unfortunately passed away, and there was a verdict of $45 million. Well, that $45 million is going to get passed on through the insurance companies to their clients and to patients in the forms of elevated healthcare premiums. One of the other complicating factors of the American healthcare system, which again adds significant financial weight to the problem, is the excessive administration. Now, and that's tied into the medical malpractice crisis. Doctors are scared of getting sued, and so they practice what's called defensive medicine. Now, defensive medicine has two components. One, there's the ordering of an excessive amount of tests and unnecessary diagnostic interventions, just to cover themselves should they get sued. So if a doctor gets sued and is in court, a malpractice attorney will ask him if he ordered all of these tests, even if they weren't clinically necessary. And if he didn't order any of the tests, the lawyer will make the case that the doctor was negligent. So what doctors do is they order everything just to make sure that if they do get sued, that they've got themselves covered. The other part of the administrative burden is the excessive amount of paperwork that's involved in the management and the running of a medical practice. Now, a lot of people probably don't know this, but when you go in to see your doctor, and the doctor spends time with you in his office, there's a mountain of paperwork surrounding one particular visit. There's an extensive documentation that needs to go on regarding the consultation, but then to actually get paid for the consultation, there's a huge amount of paperwork that needs to be sent into the insurance companies. Now, of course, a physician doesn't have the time to do this on his or her own, so the physician is obligated to employ a team of administrative staff. And of course, employing all of these staff, providing health benefits, providing retirement plans, adds extra cost to the running of a medical practice. So it's another financial pressure on the physician. Within the defensive medical arena, and some of the responsibility that really lies within society, also are the expectations of modern medicine. 21st century America is fortunate enough to be the beneficiary of modern day medicine. And people are living longer, healthier lives, to a large extent because of improved social conditions, but also because of the advances that have been made in medicine. But unfortunately, what that has done is it's created what I refer to as a monster of unrealistic expectations, so that if something goes wrong, there's an adverse outcome, or a patient happens to die, people think that something terrible has happened and they sue. That's just, that adds further pressure to the system, and it fails to recognize the frailties of medicine and of the human condition. That physicians are humans, they do sometimes make mistakes. Medicine is not perfect, and quite often the outcomes in medicine are not perfect. But suing doctors and suing hospitals is not the answer. The last 10 years, within a lot of arenas, particularly in spine, has seen the evolution of minimally invasive techniques. Now, these have been a very positive force for the healthcare system, because what they've done is they've enabled procedures that used to only be performed in hospitals, with patients requiring 3, 4, 5 days stays in hospitals after surgery, to be performed on a same-day basis. So minimally invasive techniques, which are based principally upon the use of fluoroscopic guidance and interpretation, allow complex spinal procedures, they allow complex orthopedic procedures to be carried out on a same-day basis and at a fraction of the cost that that would be required if the procedure were to be carried out in a hospital. The other point that's made within the Affordable Healthcare Act is the issue of hospital-acquired infections, which is nosocomial infections, and the issue of hospital readmissions. Now, these two elements are major contributors to elevated healthcare costs. And in fact, the number that's been given is that if the infection rate that currently exists were brought to zero, and the readmission rate were brought to zero, that 18% overnight would become 16%. So just addressing those two elements would bring the percentage of the GDP down to 16%. Patients have to be responsible for their own health. Ultimately, that is the surest way to address the healthcare epidemics. People have to exercise, they have to be responsible for a healthy diet, and within the arena of food and the procurement of organic and nutrient-rich foods, vegetables, fruits are all good. Keeping away from processed foods is good. The issue, however, relates to a point I brought up earlier about the food industry. Now, the food industry has an obligation and a role in this complicated arena. The food industry makes billions of dollars every year from selling processed foods. And the interesting thing is that the processed foods are substantially cheaper than the healthy foods. So to buy fresh vegetables, to buy fresh fruit, to buy fresh produce is actually a lot more expensive than buying fast foods. And so what's happened is there's been a stratification of health. So people from lower socioeconomic brackets are actually the ones that are getting hit the hardest with this aspect of the healthcare system, and are the ones that are in the weakest position to be able to deal with the obesity, the diabetes, and the hypertension. So in Washington, D.C., the lobbyists for the health food industry need to come into the discussion, as does the health industry, and actually be given a seat at the healthcare table and asked to make modifications to their industry so that healthy organic foods can be provided to everybody, starting primarily with children in schools. Now, one of the techniques, which I think is a very constructive technique within the Affordable Health Care Act, is the issue of identifying physicians and centres that provide high quality care. Now, America has had a system for many years called fee-for-service, which essentially is every time a doctor provides a service, whether it's a consultation in the office or whether it's a procedure, he'll send out a bill to the insurance company, and the bill will get paid. That encourages an overutilization on the part of the physician of the services, regardless of whether the physician is actually getting the patient better or not. So, for example, if you have a patient with diabetes who is being looked after by a physician, and the patient really isn't getting any better and is just continuing to remain dependent on medications, whether it's the oral hypoglycemics or his insulin, and keeps on seeing a doctor, that doctor is not getting the patient better. He's not curing the patient, which is really what this is about. It's about providing a cure. So the Affordable Health Care Act has now implemented systems whereby doctors have to collect clinical data on their practices to prove that they are actually getting people better and are curing people of their conditions. Those physicians and those clinical entities will be rewarded. The physicians and the clinical entities, the hospitals, the surgical centres that don't, will not be rewarded. And so that will separate the medical wheat from the medical chaff. One of the issues that came up with the drafting of the plan and the manner in which healthcare services should be provided was a discussion about surgical centres, which are the ambulatory facilities, and hospitals. Now, surgical centres are much smaller facilities than hospitals. They require a lot less cost to run. They have a much lower incidence of infection because people don't stay overnight, and it's the staying overnight and the prolonged hospital stays that lead to nosocomial infections. Hospitals, on the other hand, have a much higher incidence of infection, have a much higher running cost than surgical centres because they have to keep the lights going, the electricity going, the water going, regardless of whether the hospital is 10% occupied or 100% occupied. So they are fundamentally a much less efficient form of healthcare delivery than surgical centres. And the Affordable Health Care Act is moving towards having healthcare delivered in these types of settings, so moving away from the hospital inpatient basis. Now, I talked about this earlier, and being a physician and understanding intimately the cost involved. There's the administrative cost, the cost of running a medical practice in terms of dealing with paperwork. So for one physician in the state of New Jersey, that one physician has to employ, on average, 7 people in his office who do the scheduling, what's called the pre-certification, which is a process whereby the physician will send in a request to an insurance company to gain authorization to treat a patient. And then, of course, the process of sending in the bill and following up with the insurance company to get the bill paid. Now, the Affordable Health Care Act is also looking to streamline that process, as are certain insurance carriers, and one of them being Horizon Blue Cross Blue Shield. And the New Jersey version of this carrier has been very progressive and innovative in the development of certain policies to help bring down the administrative burden by streamlining the application for certification and the payment of bills. One of the big problems in America with the healthcare system, and I noticed this many years ago when I came to the States, was the fragmentation of clinical facilities and physicians. Now, in the United Kingdom, admittedly it's a smaller country, it's a population of 65 million, and it's a lot more homogeneous. The NHS, the National Health Service, has one centralized database where all clinical information on all patients is kept. So that if a patient goes to a different doctor or to a different hospital, that facility can immediately access the clinical data on that patient. So they won't repeat certain tests. They won't have to send the patient again for a CAT scan because they are not able to access the information from a CAT scan. In America, there's a complete disassociation of physicians' offices, clinical facilities, and healthcare systems. They don't talk to each other digitally. Now, again, the Affordable Health Care Act is looking to change that so that we have one system implemented across the country so that a patient in California, if he happens to be in New York and has an accident or gets sick, if he goes into a doctor's office or a hospital, that facility or that individual will be able to log on and access the individual's clinical database from wherever he's gone to in the country. And what that will do is it will bring down healthcare costs by not having to repeat certain medical tests and expediting or speeding up the process by which the patient is treated. That part of the Affordable Health Care Act is actually going to take approximately 4 to 6 years to properly implement across the country. Now, it seems as if as you put out one fire and address one issue, another fire seems to pop up, and that seems to have been the case recently with the epidemic. They're referring to it as an epidemic of heroin addiction in America. Now, this has come on from the chronic pain epidemic that commenced in the early to mid 1990s, and in the initial dispensation of a medication called OxyContin, which then became, or which then a lot of patients went from to using street-grade heroin. So the Center for Disease Control, the CDC, has labeled the opiate addiction, and particularly the heroin addiction, as the number one public health crisis. And a lot of money is now being channeled into the management of addiction. So that seems to, or that is actually occupying now an increasing amount of the budget. But the issue of diabetes, the issue of obesity and hypertension, these seem to be on the wane, and the predictions for their incremental decrease is that within 6 to 8 years, the numbers of patients suffering from these ailments will have decreased by approximately 20%. And that's going to, in terms of what it's going to do to the healthcare budget, it's going to bring it down by about 1.5%. So the Affordable Health Care Act, I think, has been a good thing for America and for the health of America. I don't think that the system that was in place prior to the introduction of the Act was sustainable. I think that when you compared America to other westernized countries around the world, the United Kingdom, Europe, Australia, South Africa, that spend a fraction of their GDP on healthcare, but yet their social indices in terms of well-being, in terms of mortalities and morbidities, are much better. I think there was a huge disparity between those numbers. And I think that as the percentage of the GDP comes down and people become more responsible for their own health, I think that a lot of the costs that I've talked about in this piece will begin to disappear. And I think America, 15 years from now, will be a much healthier place than it is today. So I'd like to thank you all for watching this episode of 9. and good evening.